Hello everyone, and good afternoon from Kiev, Ukraine. It is Tuesday and we are here to discuss the Boehringer Ingelheim collaboration with Solve.Care. I am delighted to speak to you all today, and I have a presentation that I want to do in a couple of minutes. But first, I want to thank everyone from the community for the incredible support, enthusiasm, and excitement that we have been receiving from all of you before, during, and after the recent announcements. And there has been a lot, right? One of the criticisms we have heard is, my goodness, you guys keep doing more and more. And I guess the implication is that how can you sustain this kind of a speed and velocity? But the team is doing a really great job, and our clients are doing a fantastic job in guiding us as to what they need. So all in all, I couldn't be happier. So with that, let's go forward and jump into what we are going to talk about today. And that is the Diabetes Care Network that we are launching with our new client, Boehringer Ingelheim. Before I get started with the deck, I really want to thank the Boehringer team, if they are listening, and I think many are from around the world, for their partnership with us. We have been very fortunate in working with some of the most advanced thinkers and really competent leadership team on their side in this long journey. And this certainly has been a journey. This decision to launch a care network with us was not done in a day or a week or even a month. It has been quite a journey, several months, and a lot of conversations and meetings and discussions. So thank you for the trust and the confidence you have placed in Solve.Care. And we certainly intend to honor that trust by executing and exceeding your expectations. And to the rest of the community, I congratulate you for your participation in the Solve.Care journey. We have had quite a run, and we will continue to have a run that will redefine healthcare. I firmly believe it, and every day I see more evidence that what we are doing is making a difference and will make a huge difference moving forward. I have a short agenda today, but a lot to cover. So let's jump into the agenda for today. The first is a little bit more background into the collaboration with Boehringer Ingelheim on the Diabetes Care Network. More details around the Diabetes Care Network. What is it? Who is it for? What does it bring to the patient's life or parent's life? And then I want to talk to you also about additional care networks that we are looking at launching along the same lines, and how Diabetes Care Network serves as a template for many more networks. And time permitting, we will do some Q&A as well. So let's get started. So first, Boehringer Ingelheim as a client. As I mentioned already, this discussion with them began in 2018, and they have done a tremendous job in analyzing options and in figuring out what they want to do and who they want to do it with. What we're doing together is launching a diabetes care network that truly gives the patient, the parent of the patient, or the son of the patient, the ability to manage diabetes in a manner that is much more guidelines-based and is much more relevant and personal to the person who is impacted by this terrible disease. And diabetes is of great interest to me personally. My family has a long history of diabetes, as do many of you. It is one of the most prevalent diseases that once you contract it, rarely leaves your side till the day you die. It has a massive human and personal and financial cost in every society around the world. This is not something that impacts only the developed countries. It affects everyone, whether rich or poor. So it's an important area to impact humanity, impact healthcare, impact cost of care, and reduce suffering when we can. So our collaboration with Boehringer Ingelheim is a multi-year contract. We are committed to delivering, building, running, and optimizing this diabetes care network for many years. And there are many milestones along the way, many checkpoints along the way. But the goal is to not just do it for a few months or a few years. It is to really run it for the long haul. And it is a very large commitment from Boehringer in the process. This is not something that is done easily or quickly or can be maintained and run properly without proper funding, and they have made a significant commitment to this project, and we appreciate that trust, and we certainly will deploy this funding and revenue to deliver a truly functional and effective and relevant network for many, many people. The journey to get this contract signed was very long, and it should have been, and it was. We are launching something that is highly innovative, that has not been done before. It uses blockchain in a very innovative manner, which allows us to improve care costs and reduce risk for everyone. And we're talking about not just patient risk, but also provider risk and insurer risk and even pharma risk. In that, we need to make sure that people have a completely auditable trail of their care when it comes to this complex disease and this complex care. And one of the things that really struck me when we started to talk with Boehringer Ingelheim team was how patient-centric they are and how patient-centric we are. There was a lot of talk about sustainability of the network, but there was a bigger question about, will it really be usable by our parents, by our children, by our co-workers in a manner that is truly different and definitively helpful? And we always came back to, it's all about the patient. And I particularly remember a session with some of the top leadership of Boehringer where they spoke to the key success factors. And we talked about keeping it simple, keeping it understandable, relevant, personal. And the word that emerged was intimate, that the network must be intimate to the patient. It shouldn't be just something you read on the website or something you hear in the passing. It has to be so relevant and personal to me. And what the blockchain can do here is to really ensure that my care is personal, relevant, and effective for me. So we're very excited about the fact that this network really leverages what we built the Solve.Care platform for. Our platform can do a lot of things, but end of the day, it's all about coordinating benefits, coordinating care, and coordinating payments. And this is the blending of all those three things. In some ways, it's all about coordinating benefits from an insurance perspective, coordinating care from a patient-centric perspective, and ultimately making it possible to make this disease affordable as best as possible in terms of care and who is paying for it. So this is a long journey. The network today has a very clearly defined focus around patient-centric care management, but we see a lot of potential opportunity to really address all three areas that we are focused on as a company. Solve.Care wants to impact clinical care, benefits, and benefit administration and cost of care and payments for care in a more holistic way. And this is a great step in that journey, in that direction. The last thing that I'll say is very intriguing and very comforting when you launch something so innovative in the market is that senior leadership from both sides is very involved and committed. In fact, we have seen very, very early on engagement with the decision makers, with those who really put their stamp of approval on this project after they became fully engaged and involved and understood what we are trying to do together. And that leadership involvement is critical. Many projects, if not all projects, have issues along the way. They're going to have the good days and the bad days. And the days when you need to sit down and discuss this change of course or a course correction, and you need the leadership's involvement to do that. You need that leadership to say, I believe in the mission and the vision and the strategy and the destination. We may have to take a detour and change lanes to get there, but we will stay the course. And that commitment we feel very much exists on both sides of the equation. So again, very excited about not just the fact that we have this collaboration in place and the scale of this collaboration, very excited about the fact that both sides are very committed to success for the benefit of the patient, for you and I, for our parents, for our children. This is all about what we can do to help people be better and to take care of this disease when they do contract it. So this is a very powerful collaboration between two very innovative companies, and we are honored to be able to call a reputable and incredibly innovative and a long historical innovation or driven company as Boehringer as a client and as a partner. And we will learn from them as much as we will do for them. So we look forward to a very powerful result here over the coming months and years. Now, let me introduce you to the what. What are we really doing here? So what we have decided and built and configured is a diabetes care network. Now, those of you who don't remember or don't know, Solve.Care platform is designed to launch care networks. Care networks can be about coordination of benefits like eligibility or referral or appointment or pre-authorization of care or coordination of benefits with other insurance companies, on and on and on. Or it can be about clinical care coordination, which is what this network is about. It's about making sure that the patient and the doctor are aligned with each other, the doctor and the specialty care provider are aligned with each other, that the patient's family is connected into the care process in a manner that the patient has the necessary support. It's about the fact that healthcare is a team sport, and we want to have the team play together and in sync. And to do so without the dependency on centralized systems like electronic medical records, which really don't talk to everyone. They talk to one or two stakeholders in the process. And that's fundamentally what we are trying to change. We're trying to bring coordination of care that is not hindered by and limited to the boundaries of the centralized systems that either the insurance company or the patient or the provider has. And patient like you and I don't have any systems, so we are kind of left out in the cold. So the objective of the care networks is to have all stakeholders participate in the network using something very powerful and simple as a care wallet on your phone. And now you are in the play. Your voice is at the table, and you have an equal role in managing your care and in receiving the care in the most proper way and being the best possible self-care consumer that you can be. So this is about redefining the relationship between patients, doctors, and insurers and other stakeholders, and using that redefined relationship to derive better healthcare for all of us. So that's a clinical side. And the third side is the payment side, right? It's about how do we eliminate fraud, waste, abuse, cost, friction out of the payment system, so people, doctors and pharmacists and labs and specialists and those who need to pay and those who need to share in the cost of payment can all work together in a manner that is much more real time and a lot less prone to inefficiencies and payment costs. So those are three legs of our platform. This diabetes care network is the middle leg. This is about clinical care coordination. This is about making sure that the patient has highly personal, relevant, intimate information about how to take care of their disease or their parents' or their child's disease related to diabetes. This is about reducing the risk related to complications coming out from cardiovascular diseases, which is a deadly combination often. If you're a diabetic and you have cardiovascular disease or a high risk of it, that's a very risky place to be from a clinical perspective. Bad things can and will happen. And the goal here is to inform the patient of these risks, teach them how to manage that risk for themselves and relevant to their need. We're not talking about sending somebody to a website to read about diabetes or cardiovascular disease. We're saying to them through the care wallet and through the blockchain, this is what you need to do to manage this risk, whether it's prescription or appointment or a checkup or an A1C exam or managing your weight or sleeping better. This is relevant to you. It's about your disease, about your risk, not some generic statement on the web that you have to understand. We're not going to make the patient an expert in managing diabetes. We're going to make the patient really good at managing their diabetes. That's the goal. And in that journey, you have to also teach them what is it really recommended, both from what you can do yourself and what your doctor can do for you. Remember, patient is going to rely upon and should rely upon the clinical advice of their clinician, their physician, their endocrinologist, whoever it is that they have, ophthalmologist, optometrist, doesn't matter. The objective is that those people are in sync on what this patient should and can be doing to take care of themselves, right? So in that regard, it's about sharing, giving and sharing and aligning everybody on the best care models, best care pathways and recommendations. Not just saying you should do this, but saying this is what you should do and this is who should do it for you and this is how and when you should do it. And and to achieve that goal, you also got to engage people who are not clinicians in your care. I know that the person who reminds me of my medication and who reminds me to do things that make reduce my risk of diabetes is my family. I know that my daughter, my wife are going to be very involved in making sure that I do things the doctor recommended. They also want to know what is recommended that we should discuss with the doctor about my care. So it goes both ways. It goes to the point of saying, what did the doctor tell you should do? I'm going to help you do it. And what should the doctor be telling you that perhaps you forgot or perhaps we need to have a dialogue with the doctor around why aren't we doing things that are known to help. So it's a bilateral recommendation model, right? So in that regard, we are we're creating this really cool concept called Care.Circles in the Care wallet, where I can link my wallet to people who I choose to include in my Care circle, and now they are equal participant in managing my care, and I'm not just alone in this journey. And the good news is that as a Care circle participant, that person does not need to be an insured member or needs to be in my employment group with my employer. These are people I choose to engage in my Care circle because they care about me. So this creation of a network within a network, which is what has always been our theme, it really works well when you talk about chronic disease management. So this is a huge new innovation that is part of the Diabetes Care Network launch, but will go beyond this particular network in that we are introducing Care circles as part of creating patient-centric networks inside a sponsored benefit network that Solve.Care platform allows. I think this is incredibly powerful. I know that my family and my kids are very much part of this Care circle model, and I hope you all will find this equally useful. So what does the network deliver? So if you recall, or those of you who know and those of you who don't, when you connect to a network in the wallet, you get certain cards. Those care cards are very relevant and personalized to your wallet. So these are the cards that we plan to deliver through this network in phases. The most important, of course, is ADA, American Diabetes Association guidelines around how to manage my disease, given my age, my gender, my condition, so that I can have relevant personalized guidelines that I can actually execute, actionable guidelines that I can take advantage of, or my family, my Care circle participants can take advantage of, and to do what we can do to manage this terrible disease. Then there is prescription management, which is around reminders on when to take the prescription, report symptoms, and which is a related card to this prescription management, reminders about refills, potential help them take the prescription the right way, what to do when you skip a dosage, should you double up the next dosage or just keep going, and so on and so forth. And related to that, as I mentioned, reporting symptoms if there are some symptoms that are triggered by a prescription that perhaps my clinician should know about. Self-care opportunities that go beyond the guidelines in terms of what my care provider has mentioned to me that I should be doing, whether it's to reduce my body mass index or increase my water intake or sleep more, stress less, and to have that actually traceable and measurable in the care ledger to the degree that I can work with my physician to create personal care plan, which I can then see my progress against. And that care plan on the chain allows all the Care circle participants and all the clinical care providers that I'm talking to understand how well am I doing. And then of course there is the core capability of making an appointment, dealing with referrals, and getting transportation subsidy from my insurance company if any exists. And those are additional cards that will appear depending upon which insurance company I am insured with. So you can see how we are bringing together clinical care coordination and benefit coordination all together into this diabetes care network. So who are we launching this network for? We're launching it for about more than 25,000 patients who are identified as having type 2 diabetes and who are either have or are at risk from cardiovascular disease. So this is actually a list of patients that we are launching the network for. This is not a network we're launching with a hope that somebody will hear about the network and download the Care wallet and join. This is a network for a very specific, known, individual, clear, identified patient group that we are inviting to join the network, and they are already in this group of patients that can benefit from the network in terms of they have the certain disease and they're at risk from another disease or already have a combination, which leads to a very high risk of catastrophic events down the road. So they have a strong reason to join the network, but there is clinical and personal benefit here. And there is also a targeted outreach to these members because we know who they are. We're not reaching out to into the ecosystem or ether and saying, who would like to join the network? We know exactly who then the participants are, and the wallet is being delivered to their email and to their phone in very clear and directed communication. So that's who the network is for. It's for a very well-defined, well-known, well-understood, identified group of patients, list of patients that have this disease and have this particular risk. So we are on a very aggressive timeline. As always, those of you who follow Solve.Care know that we don't really do things slow or and don't really take a lot of time when we set our mind to something. So our contract was signed at the beginning of June. We told you about it literally within a few hours of contract signing. Our requirement process has kicked off. Requirements and design will be finished by end of July, and configuration should also be largely done in that same time frame, configuration of the Care network. And we expect the client to spend a good several weeks in the acceptance mode, and then a controlled launch followed by a full launch in Q4, depending upon how fast we want to move to do the outreach and to get feedback from the clients. Now, this is not going to be a linear journey. This is a simplified diagram. We will probably learn along the way. We'll probably get feedback along the way. We'll probably have aha moments along the way. So there will definitely be additional steps. But what is not changeable is that the network must be launched this year. We are going to have this network in production in 2019. Now, I want to talk about what this network really means when you step back and you say, okay, so this is fantastic. You're launching a diabetes care network, and that sounds great, but where does this really go in the big scheme of things? And we've often said that we got to change the way healthcare works. So here is a bird's eye view of what we see and our insurance members see as the journey ahead. So I mentioned to you all that there are different types of networks. So the diabetes care network is the sort of the left-hand side, and it's one instance of the chronic disease type network. And the objective is what we discussed, patient engagement, provider information and education, and the potential opportunity to coordinate clinical care and coordinate benefits. But there are other networks and network services that we are launching. Some of them you already know about, transportation services. We are looking at telemedicine network, pharmacy network, and benefits network issued by employers or insurers. And these networks will come based on who the sponsor is, and many of these are in various stages. So you can fully expect to see in the Care Wallet a menu of networks you can join. The point here is that depending on where you are in your life, whether you're a young and healthy member today, or you have the happy event of a pregnancy, or you have developed a chronic disease, or you've reached late stage in life where you have multi-chronic diseases, depending on the stage of your life, the same wallet can join different networks. And the same insurance company can sponsor different participation for you. They can say to me, Pradeep, you are generally young and healthy, well, no longer young, but you're generally healthy, but you're either in a pre-chronic or in a chronic condition risk of diabetes. So we're going to have you join this additional network on the left side, and we're going to sponsor certain cards in your wallet, which will come from this network, and that will help you prevent the onset of diabetes. Versus, for your kids, we're going to make sure they have access to telemedicine, so you don't have to run your son to the emergency room. There is options to deal with normal fear of flu and virus and things like that through telemedicine. And we're going to give you transportation benefits when needed for you to do your annual exams, and so on and so forth. The idea here is very clear that insurance companies may sponsor and will sponsor their benefit network, but they can also sponsor your participation in other networks that may be created by somebody entirely independent, and will be. So the fact that the diabetes care management network is being launched for diabetics with cardiovascular disease risk allows the insurance company, who has nothing to do with the creation of this network, to say to their members, join that network and we'll pay for the cost of it, and we'll take care of the Solve tokens that are needed for you to connect your wallet to that blue network on the left, while you're also connected to the orange network on the right. So allowing the member to join different networks at different times and sponsoring them through Solve tokens allows the insurer to really change the way they engage with members, the way they manage the member's journey of health and life. And we can do that both as an insurance company, as an employer, as a government agency, even as a member myself. If I don't have insurance, if I don't have a government agency taking care of me, if I don't have an employer, I still have the option of using the wallet to join the network that serves my need or my family's need, in which case I am the one who's going to go procure Solve tokens and use whichever network that I need to join. And when I don't need it, I don't need it. I can stop using that network. So this notion is that the wallet stays with you forever, but the network you participate in or networks you participate in changes based on who you are, where your family is in terms of health and need, and you can manage their need and your need in a very granular, very personal, very intimate way. That's what we're trying to accomplish. And when you think of that model, it's very different. It's not insurance-centric. It's not employer-centric. It's not government-centric. It's not dependent upon where you live and who you work for and what insurance you have. Those are all very important things. And we hope that you will have a lifelong relationship with your insurer rather than a short-term incidental relationship. But even then, the wallet is always yours. And the networks you join is always your choice. And whether the insurance company is sponsoring the network or you are self-sponsoring it, doesn't matter. You drive what makes the most sense for you and your family. And that is the patient empowerment we talk about all the time and that we are implementing here in a really powerful approach, because end of the day, this creates a sustainable journey for you and I, and it allows my insurance, my employer, my government agency, my pharma partner, or my hospital or my doctor to join my network, in essence, join my wallet to take care of me rather than me being the outsider trying to find a portal or a login into some EMR system that I'll never log in twice. We are not an EMR solution. We are a patient-centric solution that can and will connect to EMRs as needed, but we don't need an EMR to function. We function as a sponsored care network that anybody can launch and that Solve.Care can launch depending on the geography and the need. So I want you to take this in and understand what we're doing here is really a mirror image of how healthcare has been run for so many years, and not to the best advantage of the patient. This is all about empowering your parents and my kids to be much more effective in managing their care and their health. Now, when you look beyond diabetes, here's a quick look at all the other diseases that have similar footprint in terms of scale and impact on humanity and need for ongoing care, and the fact that they're universal, whether it's heart disease or cancer or Alzheimer's or chronic COPD, chronic obstructive pulmonary disease. These are diseases, things like asthma, they're everywhere. They impact practically every single human being on the planet. And the objective is that we don't stop with diabetes, we just start with diabetes, and we continue to build out other networks similar and different to manage many different diseases, but to prove the model with this network and then to replicate, both in terms of disease as well as in terms of geography. Just to put some perspective in numbers, when people say, isn't Solve.Care a platform for US and developed countries? Look, the prevalence of diabetics in the world is really everywhere. When you think about almost 11% of the population in one of the most populous countries in the world is diabetic or at high risk of being diabetic, and then you compare that to Hong Kong, which is at 10%, and you look at India, which is at almost 9%. These are staggering numbers, because when you think about these 5 countries, they represent a massive population of several billion people. So when you think about, we're talking about hundreds of millions of people who have or will contract one of these 10 diseases. And then when you think about all of the portfolio of diseases that we are focused on, it really touches everybody on the planet. So let me summarize. Why are we so excited about this? Obviously we are, because one, this is a huge validation of our platform by a very credible, very methodical, and very careful partner client. But really what we are most excited about, beyond the fact that we are honored to have Boehringer as a client, is that this is about delivering real value to patients. This is about blockchain not delivering something that maybe I would enjoy using or maybe I should have. This is about lives and health and people surviving and dying prematurely or living to see their grandkids. This is also about driven by ROI, return on investment. We're not talking about just adoption because it's cool or it's helpful. We're also talking about a real economic driver, because there is actually cost savings for insurers. There are cost savings and efficiency improvement for providers. There's efficiency and efficacy for those companies who invest in these products, the pharma products, that need to be used in the right way for the right patient at the right time. So there is value for patient, insurer, provider, pharma, and then for society and economy as a whole. Obviously, we are always driven by, is there ROI? And I think we can safely say that this is a great use case for driving ROI. Now, could you do it without blockchain? Sure, you could. Theoretically, we've been doing all of this for so many years. The world existed before blockchain. The world will exist if blockchain ceases to exist. But reality is that it is much harder, much more complex, is much less effective to do what Solve.Care does today without this underlying technology. We could also live without computers. We could still use abacus, or we could use paper and pen to compute everything by hand, and we used to. The efficiency wasn't there compared to where we are today, right? So this is not about you can't do it without blockchain. It's about you can do it way better with blockchain than you can any other way. And tell me any other model where patient has truly been given a equal right, equal relationship model, equal say and actionability, and has worked. Because I built plenty of these backend systems and silos and websites and apps sitting in the insurer chair or in the public program chair or in the clinical chair. And look, adoption is almost nothing, and it always is just another window into another castle. None of those systems are talking to each other and never will. So we are really talking about saying, okay, we're done waiting for this utopia of integration, and let's focus on enabling the patient and creating patient-centric networks that others join, as opposed to us always saying to the patient, you're an afterthought, and here is your login and password when you think about joining or coming into my website. So this is really a different approach, a different model. It's a mirror image of how things have been done, and it is a lot easier to do with blockchain and any other technology so far. And the combination of blockchain and cloud and mobile technology, and now looking ahead, data and analytics and intelligence, those are fundamental drivers of change, and they're going to be. So I am very excited to be part of this journey, because beyond being a technologist, I am a parent, I'm a son, and I want to see things done differently. We got to change healthcare for the better, for you and I. Now, the other thing that's really exciting is that this is relevant not just to the US. Yes, we are launching it in the United States. Of course, these 25,000 members that we have identified are clearly identified as US residents. But this is not restricted to US. We're going to see diabetes care coordination model on Solve.Care platform, essentially mirroring what we're building really everywhere. And we saw the numbers earlier. There is a huge economic and social impact of this disease in developing countries, perhaps more so than even developed countries, although I would argue human loss of life and human loss of capability prematurely because of this disease is a loss everywhere. So this is a big cost driver to payers, to insurance companies, to societies, to employers, to governments, to people, to their families, and we see there is no restriction to where we will take this type of a model next. And it isn't limited to diabetes only. We talked about how the same exact model applies to many of the top killer diseases in the world, many of the top chronic conditions that need continuous and long-term care. And underlying that, Solve is now clearly moving into an undisputed global utility model, where we are certainly not only seeing the Solve token used for the wallet and the network sponsorship, we're also now seeing Solve token is becoming a vehicle for patient incentives and provider payments. So every single network we launch, every single sponsor we have for a benefit network or a care network or a payment network leads to a much more of a universal and repeatable use case for Solve.Care, for Solve token. And finally, as soon as we launched, and even before we launched this network, we were receiving and are receiving tremendous interest from pharma companies with other innovative solutions and therapies they want to bring to market. And we basically said, we made a commitment that we're going to focus on Boehringer and make them tremendously successful before we look elsewhere. But the opportunities are lining up, and there is tremendous interest from both pharma as well as payer insurance space in leveraging this kind of care management, disease management model to reduce cost and reduce human impact. So overall, when I look at it, this is a perfect alignment between our vision, our execution, and the adoption of our platform by a really relevant, credible sponsor such as Boehringer. And therefore, again, I want you all to be extremely proud of being associated with Solve.Care in one way or the other, because this is the kind of innovation and execution and progress that I would have dreamt about for any company that I was supporting. So I appreciate all your help, appreciate all your support, and stay in touch with us as we progress down this path. Given that we have some time, I'm going to ask my team to hand me some questions and answers, and I'm going to switch over to a camera view, and then we can get started on the Q&A. So I have a few questions here. Can you provide more information about Care.Circles that were mentioned during the announcement? I did cover that topic a little bit today, but I will summarize it in about 30 seconds. So Care.Circle is the ability for a patient to invite other care wallet holders to join and participate in their care coordination and in even cost sharing. And the Care.Circle participants are by invite and by consent only, and they have no other eligibility requirement. So I can invite my mom to join my Care.Circle even if she's not insured by the same insurance company, and I can be participating in her Care.Circle through my wallet, where I can participate in the cost of her care, or I can manage her ability to pay or to get in the car and go see a doctor. Any number of things that I want to do to help her, I can do as a Care.Circle participant. And I don't need to be part of her insurance plan. It's the ability to create wallet-to-wallet circle of care participants who can see certain things about me, who can share in certain costs that I'm incurring out of pocket, and who can actually give me guidance support when I need it the most, when I'm ill. So Care.Circles is a notion of a patient-centric network inside a sponsored care care network on the Solve.Care platform. Excuse me. BI also has IBM as a blockchain partner. Do we plan on integrating or working with them in the future? Well, Boehringer is a global organization, and I cannot speak for what their plans are with various vendors and various other technology partners. But what I can say is that our platform and our solution with BI is very much a relationship between BI and us, and it is our job and our mission to deliver the care network. If there are opportunities for us to partner with some of their other technology vendors, we will certainly evaluate them, but there are no such discussions or commitments in place today. Having said that, we are evaluating partnerships with many different clinical, technology, and geographical partners. As I mentioned to you, regional strategy for partnerships that I mentioned last time, we are very much executing that. So there is no limitation to who we will partner with, as long as they bring value to our care network, bring value to our care wallet holders, and bring value to our network sponsors. If they meet one or more of those three criteria, we're open to talking to them. Excuse me. The next question is a really interesting one. Having BI as a client is one thing, but massive adoption is another thing. Could you share some insights on the expected number of consumer adoptions within 1 year and thereafter? So we are not a voluntary adoption model. We have never believed that you should build it and hope somebody will come. We are very much a sponsored benefit platform. There is always a sponsor for the network. There's always a target audience for the network. And there's always an effort to get the audience for whom the network is launched to either through mandate or through incentives or both join the network and use their benefits or their care. So we are very much driven by who is the sponsor of the network, how many participants in the network they're targeting, how are they designing the eligibility for participation, how are they incentivizing and rewarding that. But at the end of the day, that's what our network sponsor is doing with our help. So we are very confident in our adoption model. We have already seen it exceed any other expectation that you would have of a mobile app, if you will. When you look at how our payment network is working, we have a vast majority of the payments happening through our wallet, not a minority, but a majority. And typically you end up with single digit or low double digit adoption levels. We are not going to fall into that trap. We have a clear strategy on how adoption should be and will be achieved and is being achieved. We will not project on number of actual wallets and number of actual networks in the market. That is a path of peril. We don't want to make public statements and then fail them. But what I will say is that our strategy has been crystal clear. Sponsored benefit networks, which have a clear target audience or stakeholder, as we call them, network participants, a network sponsor that is offering clearly defined benefits through Care.Cards to those participants, and a clear adoption strategy by incentive, reward, and or mandate, a combination of that. And yes, we are going to strive for each network. Our target is that we want to see participation by 70% or more of the members, but 70% is, in my mind, a threshold, not a goal. We should be looking to achieve higher adoption. And if a network is not achieving that adoption, we're going to work very closely with them to figure out why that's not happening. Will the initial BI Care cards be informational only, or will they allow for authorized purchase and delivery of drugs? It's a multi-stage rollout, and there are definitely informational cards. There are also actionable cards. And then when it comes to actual pharmacy prescription fulfillment, there are also future stages where those cards can be activated. It depends a lot upon how fast and how aggressively BI and other partners, Boehringer Ingelheim and other partners want to move. The answer is yes to all of the above, but we are going to roll out cards based on feedback and need from both patient and provider. But initially we are focused on disease management, symptom reporting, clinical care guidelines, referrals, appointments, and the prescription delivery would be something that we would do in a subsequent phase, not in the current scope of things. If the pilot is a success, do you envisage that Boehringer Ingelheim will wish to expand the network scope, and might that be cross-border? Well, I certainly hope so. I mean, again, I will not speak for the client and presume to tell you what they will or will not do, but we fully expect that based on the network success and based on the lessons learned, there are multiple phases down the road which will leverage this learning. Beyond that, I think it would be like reading tea leaves and trying to predict the future. What I can tell you is clearly this, that this is not a journey one starts for a few weeks or a few months or for one phase. The level of investment involved is too great to be, let's try and see what happens. This is very much, we must make it work. And in fact, I heard one of the executives pick up the phone and call me the day of the contract signing and said, we are counting on this to succeed. Failure is not an option. And I told him failure never is an option. We will make this work with you. But the point here is that this is a journey that will take many, many years in current form or a different form. And I will not say that what will or will not happen, but I will tell you that this is going to be a long haul, long run, and very impactful. And we will learn from this and do a lot more than we think today is possible. Then the next question is also very interesting. There are already diabetes-related apps that exist, so what is the strength of Solve.Care's diabetes network? That is precisely the point. There is an app for practically everything. And we download them, we use them once or twice, and then we practically never go back. And they add no value because it's yet another data collection engine, and I'm supposed to put in a bunch of information, and then I hope that this information will eventually be used to my benefit, and often it is not. We are not doing an app. We never want to build an app today or in the future. Our wallet is designed to deliver personalized benefits to you regardless of which ecosystem you're part of. So when you join the Diabetes Care Network, we know a lot about you. We are going to send you very personalized, actionable, clinical, and benefit care capabilities. And there is no app in the world that does that. Because most of the apps will say, tell me or let me capture information about you, and then I'll give you some generic advice, or I'll give you some even personalized advice. but it has no coordination with any other app in the world. The whole point of having a blockchain fabric as a coordination of benefit and coordination of care is that it's not what I am putting into the app, it's what the app is giving me without me having to become a data entry or a data collection engine. So there is nothing in common between a diabetes app, that any app that I know of, and what we are doing here. We are building a diabetes network based on clinical and population health management and analytics and claim data that is giving me, Pradeep, extremely relevant, actionable benefit and care coordination and care guidelines. And that's before I even enter any information about myself in the app. It's about delivery of personalized, relevant, actionable care rather than we would like to collect your heart rate or your BMI. We'd like you to wear this device and we'll capture this information and give you some clinical guidelines. So yes and no. In some ways we do what the other apps should be doing. Another way, we bring a completely different paradigm of coordinated care and coordinated benefits, which no app or no system for that matter today is doing well. Will Solve.Care be able to discuss publicly any positive population health benefits that arise courtesy of the network? That's a really great question, and it is a difficult one for me to answer. It's an incredibly important question in the sense that population health benefits is what we are after. And I use this line a lot internally. We want to deliver population health management one person at a time. Population health management by definition is aggregation of people with similar diseases, similar tendencies, similar demographics, similar clinical footprint, similar cost footprint, and then finding ways to help them. That's the population health management. But I'm not a population, I'm a person. I want what is relevant to Pradeep, not what's relevant to every other 50-year-old potential diabetic in the world. So it's about population health management applied individually to each person. And that personalization is very, very important. So will we be able to publish the benefit of the entire group and how they benefited from our network? I hope that internal conversations under NDA we will be able to. But will we be able to publish this on an open basis? That's a question we will have to get buy-in from Boehringer Ingelheim, because in the end, they would have to decide if this is information they want to and can and should share. And there's also regulatory question that might arise. So I cannot and will not comment on how much transparency around this data will be there, but I can tell you this, that we will be monitoring this data to make sure that the impact is as much as possible in the positive direction. The whole idea behind the network is constant analytics that are being used to deliver the right care card to the right care wallet at the right time. So clearly we want to maximize the analytics behind the network, or in the network, but as far as publicizing them, I think we will hopefully be able to publish enough for you all to get a feeling of how impactful we have been. What exactly is the role of Boehringer Ingelheim and Diabetes Care Network? So Boehringer Ingelheim is the sponsor of the network, and their job is and has been to ensure that this network gets stood up and is run independently by an appointed care network administrator, and for that administrator to identify and allow people to participate in this network, reach out to them and ensure that we have all the necessary back-end data to deliver highly personalized care. So Boehringer is in some ways very involved in designing, conceptualizing, and supporting this really incredible value to the patient. And at the same time, they're also an arm's length party in that they don't want to be running the network, and they will appoint a network administrator to do so. Will there be a future where you will be able to monitor patients in real time with conjunction with IoT and wearable device companies? So clearly there is a need and a value in patient-supplied data, whether it is supplied through a device they're wearing, or it is information they enter through How Are You Feeling Today card, or it's information their Care.Circle enters about the incidence of sleeplessness or nausea or weight loss or diet appetite loss. Those are where we can capture information from the patient and the Care.Circle, and we can certainly include devices in that. The objective is not to rely upon patient submitted data as a foundational gate, because if you do that, you're going to get very low adoption and very low success. But to the degree patient has and is willing to provide data, or we can provide them incentives to do so, then we absolutely see no reason not to aggregate the patient supplied data into the care ledger. Having said that, we are looking at and identifying partnerships that we will be looking to finalize in the next few weeks around IoT devices. We've been thinking and working on that particular train of thought for well over a year now, and we are reaching a point where IoT partnerships will be something that we need to carefully pursue and decide and execute. So IoT supply data is important, but it's not needed for the diabetes care network. I want to be very clear. We don't need an IoT partner IoT device to actually run the diabetes care network, nor do we expect to. But at the right time, that becomes an additional source of data for this network. Can we see the development process of diabetes care network on GitHub? If not, why? Well, the network is very much a shared intellectual property with Boehringer Ingelheim, so we will not publish their IP anywhere on the web, but we will report to you as best as we are allowed to the progress of the network, and you will certainly hear about it when it is launched, but we will not be making any code releases on GitHub when it relates to the actual diabetes care network, its configuration, its analytics. What we will continue to do is to publish the platform related stuff on GitHub. But as far as care networks are concerned, I don't foresee that we will launch, we would put out the care network code details on GitHub. It is simply too proprietary for our clients, and they have the right to protect their business model and their intellectual property. Let me see if I missed any questions. Okay, and the last question that I have currently, there are a couple more. So when will this network be used in Korea is the next question. I don't have a specific timeline for diabetes care network to be launched in Korea, because this is a decision Boehringer would have to make, and we will fully support them as to wherever they want to go. And I cannot even imply that they will take it to Asia or any other country. It's entirely their choice. What I will say is a similar model for other and this disease related to Asia is very much in play, and we are looking at other diseases and diabetes for care networks being launched in different parts of Asia. And we are very much down that road, and we will tell you as soon as we are ready to launch a chronic disease management network for one or more diseases in the Far East Asia and in Asia Pacific. So our roadmap is very clear, and we are executing on it, and we will keep you informed. But this network, diabetes care network we're launching with Boehringer, is right now US only, but there are plenty of other networks that are in play for various other parts of Asia, Middle East, North Africa. So we are very excited about the possibilities and the adoption curve that we are seeing for networks and network sponsors. The biggest goal of Solve.Care at present time. It's always the same goal, right? Set very clear objectives for the year, for the month, for the week. Plan, execute, repeat. So nothing really changes. It's relentless execution, never easy, but must be done. And we must always set our goals and then make sure we strive to meet them. And if we don't, learn and do again. In terms of the fundamentals of the company, we feel very good about where we are, both in terms of the growth curve, in terms of the product curve, in terms of the adoption of the network or the platform to launch networks, the strength and utility of our token. We're doing great on all fronts. Where I want to really focus on is diversification, both in terms of the types of networks and the geography of the network. And that is really what I told you all at the beginning of the year, that we are accelerating our Asia expansion strategy. We are moving it a year up, because we feel that the demand and the value is there. We have also since then looked at and started to expand into Middle East. We are definitely looking at Europe and getting a lot of interest there, although that's not as far along as Asia and Middle East and US and Canada are. And we have the rest of the world to explore. So one network at a time, which then covers hundreds of thousands, if not millions of consumers at a time. And that is the strategy. And we are continuing to go down that path. If I could set one very clear goal, I think that goal for this year would be to achieve a fully diversified set of networks that are both clinical, well, all three types, clinical, administrative, and financial, to be in play by end of the year. So we have a full palette of care cards and networks that we have envisioned today out in the market. Will we achieve it? It's a long goal. It's a very tall goal, rather, but we are working very hard to achieve this diversification. Are there any other questions that have come in? Okay, so looks like I've addressed all the questions that have been so far submitted. Let me go back and summarize for you all what I wanted to share again. So I'll wrap it up by saying, to me, this type of a collaboration with this type of a client, this type of a partnership where we deliver real value to patients and insurers and providers and pharma and government and employers, that has relevance around the world, that can be replicated for this disease and any other disease that requires chronic care management, and that drives additional wallets and additional networks in the market. That's exactly what we wanted to achieve and we hope to achieve, and we are well ahead of the projected curve. So not everything is easy, nothing is perfect in terms of execution, but we continue to do a great job as a company, and I'm very proud of the team that continues to outperform any reasonable expectation. And that's really because of this organization and the investment of time, heart, energy, and soul that Solve.Care team is putting in, that we can make any of these things happen. So my congratulations to the team and certainly to all the community in the ongoing support. We welcome your thoughts, comments, and questions. If I didn't cover them today, send them to us and I will have some answers put together in written form and published. So feel free to come back at us with questions, thoughts, suggestions. As always, we are very much a company that's driven by a mission and given to transparency. So I again thank you all for your time and participation, and I wish you all a wonderful rest of the day.